Salam-e-Jahan.
वेलकम बैक टू सलाम-ए-जहां नाज़रीन. डॉक्टर अमीन, मुझे आपसे क्वेश्चन पूछना था. दिस 4 डिफरेंट फील्ड्स ऑफ फार्मेसी. तो ये चारों फील्ड्स में जो है सैलरी वाइज कितना, विच इज मोर लुक्रेटिव?
आप ये पूछ रही हैं कि लोगों को किस फील्ड में जाना चाहिए जहाँ उनकी आमदनी सबसे ज्यादा है. सिंपल सा सवाल.
Well, they say that the community retail setting is a little more lucrative than the hospital setting. But it depends upon, what your emphasis is in the hospital setting. Whereas, if you are in a higher level, if you're more clinical, things like that, that will alter how much you essentially make. But it's not about how much you make, it's how much you make a difference.
Exactly, right? How much you help.
That's what you guys want.
Exactly.
But obviously, जब इतनी पढ़ाई करते हैं, इतना कुछ करते हैं, तो compensation भी सही होनी चाहिए. ये बात तो है. यहाँ से मेरे जहन में एक सवाल आ रहा है, आप तीनों से ये सवाल है, और वो ये कि to get to the levels that you guys are, इसमें कितना वक्त लगा? सारा आपसे शुरू करते हैं.
Again, because education is state by state, has different requirements. My training is between New York and New Jersey, so basically you need to have a bachelor's degree that typically takes people about 4 years, and a master's degree, which usually takes about 2, depending, full-time, part-time. And, while you're in school, then you have to do student teaching hours where you have education classes and you have to observe other teachers while they're teaching. For example, for me, it would be health education. You get ideas about how to structure your class, different types of lessons, how to use not just PowerPoint presentations, but how to do hands-on activities or things like that.
तो कितना वक्त लगता है?
So I would say, again, about bachelor's and master's, about 6 years.
Plus all the learning in the school, practically.
Well, that happens while you're in
your master's.
Yes. Okay, good. Dr. Amin, आप बताइए कि ये इस लेवल की फार्मेसी पे पहुंचने के लिए कितना टाइम चाहिए?
So there's usually 4 years pre-pharmacy, and then now they kind of evolved and they have pharmacy programs.
Yeah.
So my program was 6 years, which included 4 years of pharmacy and then 2 years of didactic training, rotations, trying to get your foot in the door, see if you like hospital versus industry versus retail, and try to see what's, what you enjoy more. And then after graduating, you have to continue because medicine's always evolving. There's new medications.
So you're constantly learning.
You're constantly learning. So you're required to do a certain amount of, they're called CE credits, continuing education credits. Every 3 years, they kind of check it before you re-register with your license.
Wow.
That's actually required within teaching as well.
Yeah.
You have extra hours that you have to do.
C is required
while
everywhere
you're
these
working.
days.
Yes.
Keeping up to date.
And Umar, आपने how long it took you to become the kind of doctor that you are?
So there's many different specialties within medicine. So for me specifically, I did 4 years of college after high school, and then 4 years of medical school, and then for my personal residency specialty took 4 years, and then after that I did 1 year of spine fellowship.
Wow.
So altogether it was 13 years after high school.
Mashallah.
Yeah.
Wow.
So different fields are different. So for primary care, internal medicine, pediatrics is typically 3 years of residency after medical school. Certain other specialties like cardiology will be another 3 years after that, or for example surgery will be anywhere from 5 years to 10 years after medical school. So for me altogether from high school is 13 years.
13 years. Okay, my God. Okay. मेरे ज़हन में एक सवाल आ रहा है. इनसे ये क्यों ना पूछें कि what is a day?
A typical day.
A typical day. So how is it, Dr. Amin?
So as a hospital pharmacist, I have multiple roles. Some days I'm in the IV room where I make, it's called compounding, the intravenous medications in a sterile hood to administer to the patients. We usually do that for some adults, but many, pediatric patients, neonatal patients who require like a very small dose or something like that. Or if I'm in the clinical setting that day, I would go on patient care rounds with the attendings, with the multidisciplinary team I was discussing before. So that would often include things like, going over the patients, and it would include things like discharge counseling. When the patient is getting discharged from the hospital, we would say, these are the medications you're on, kind of explain to them, this is how much you take this with food, you take this without food, things like that, or side effects that you should be expecting. Also, if they're on different drug delivery systems like nasal spray or eye drops or an inhaler, there's techniques to take it to optimize how much medication you receive. Also, when the patient first comes in, there's something called a medication reconciliation. So when they first come in, we want to see what medications they're on before they come into the hospital. Sure. Because a lot of times things that they're on might be what's causing the issues. So we often advise patients, tell us everything that you're on. Right. If you're on vitamins, if you're on anything that even anything the smallest thing, yes. Right? Yeah. Because sometimes vitamins can have a huge impact. Wow. Right. There's a drug called Coumadin that's a blood thinner. It interacts with so many different nutraceuticals like St. John's wort, things that homeopathic things you think wouldn't matter actually do matter and could be the cause of why these people are getting sick. Right. So oftentimes that's what we do in terms of rounds. That's how what we would address. But also in the main pharmacy, that's when we would be looking at physician orders and entering those orders, making sure the dose is correct.
Getting tired.
It's pretty complex each day for you.
Yeah, it is. How do you manage, to remember all these names of these medicines? The thousands of medicines. So कैसे याद रखती हैं?
Well, there's there's
formula
drug classes. No, there's drug classes. So let's say there's a lot of beta blockers, right? There's a certain type of medication that ends in OL. Right, so we'll memorize all the medication names, and then we know, okay, if they're on this type of medication, we know these are the side effects, and we kind of classify the medications first, and then we go from there. There's so many medications. Patients are they're called fast movers. Many patients are on these medications, and then we kind of memorize because we're experiencing it every day, so we memorize that, and then the medications that we're not too familiar with. We don't see them that often. Then if we do have questions about them, we look it up. And once you look up things, then you kind of remember them more.
How do you read this doctor's handwritings? I think that's like...
Nobody can read.
No one can read. How do you guys, you get trained on reading?
There was never a class on it, but you get used to it. You can see... if one type of physician, if he writes a G, this is how he writes a 5 or something like that. But also now hospitals have become more computerized, so they have physician order entry. Even with that, we see physicians who have a tendency to make the same type of error. Even when you do a drop down menu. And they're supposed to write if some medication is daily. They'll always write something else like as needed. But you need to know how much it's needed. So there's still mistakes in that, but it's not a foolproof system, but it is a little bit better.
Yeah. मैं तुम्हारा बताओ अपना तुम्हारी daily routine or daily.
Right. So typically I start my morning in clinic. I see patients. I evaluate their different issues. So. Like I said, typically patients complain of any sort of joint pain, back pain, neck pain. I evaluate how best to treat them, whether it's through physical therapy, medication management, or injections. And in the afternoons, I typically do spinal injections under X-ray guidance in an operating room.
On daily basis?
Most days of the week, yes.
Wow.
Okay. Yeah, so I typically will see those same patients, depending on the day. I'll see them in the afternoon in the operating room, and I'll perform the injections on them at that time.
Right. Great. Sarah, आपका दिन जो है, it starts early in the morning?
Very early, yeah.
And it goes all the way till 5 o'clock, or?
No, not until 5 o'clock. It depends on the school. Each school kind of has their own hours, but most of my experience has been within a high school. They usually tend to start earlier because if they finish earlier, then there's more time for all the after-school activities and sports and
football
games and etc.
Yeah.
So I usually would wake up around Fajr time in the morning and get ready and then go to work sometimes when it's still dark outside. Get to work, get prepared for the day. A lot of the times if I'm teaching a first period class, it could be starting at 7:30 in the morning. And usually the day ends somewhere between 2 and 3 o'clock. And then, of course, staying after school to finish doing some grading, help students who need help, send emails to parents, have faculty meetings.
Busy day.
And then when I go home, then I have a big folder full of grading I still need to finish or lesson plans I need to create.
Prepare for the next day.
Yeah. So really when I'm in school, I don't feel like that's my work. That's the fun part. The work is all those folders and the preparations and all that I'm doing until late at night.
You know, people don't realize how hard it is to be a teacher. You know, log समझते they get you know holidays or July, August छुट्टी रहती है, फिर 3 बजे job खत्म. It's a hard work.
कि घर में माँ के बाद बच्चे की जो ट्रेनिंग करने वाली है वो टीचर है स्कूल में, you know. So teacher has a big role in all the students'
and
lives,
influencing the students.
Right. Umar, ये बताएं कि do you bring any pain home from your patients?
No, I don't bring any pain to myself personally, but I do bring a lot of work home. So, like Sarah said,
I think that's a question for me.
I was going to ask you, does he really bring any pain home for you?
No, but typically, even after hours, I'll come home and I'll still be writing notes or going through charts or calling patients back to go over results. So, and even for me personally, I'm the only one in my specialty in my group. So, if I'm on vacation, if I'm sick, I'm still managing my patients remotely.
So again, really never on vacation.
Typically, I mean, but I mean, it depends. If I was a part of a bigger group, then you have more patients to cover. So there's always a give and take with that. So, but the point is that there's always work.
There's always work. Dr. Amin की जब मैंने बातें सुनी, तो I actually felt kind of stressed, you know. कि ये इतनी चीजें, इतने डॉक्टर, इतने patient, but do you bring any stress home?
You know what? It's in order to stay sane, I feel like you keep pharmacy at the pharmacy and you keep home separate. You know, because you know if you start thinking, you'll be like, oh, did I mess this up? Did I send the wrong thing up? Or did I, you know? So when you're there, when I'm at the setting, when I'm there getting asked a question, I'll make sure 100 times over. I'll double check, triple check, make sure I'm saying the right, giving them the right information, giving them, you know, everything that they need, and, you know, or dispensing the right medication, injecting it into the right medication into the bag, because I make sure 10 times over, because I don't want to think about it when I get home, and I know I did my best.
So you leave work at work.
Yeah.
Okay, great idea. You know, it's a good way to do it. We're coming towards the end of our program, and at this time, you know, we ask all our guests to give an advice for our viewers. So here's the camera. Look in that camera and give any advice that you want to give to our viewers. Sarah, you first.
Okay. I'll give a few bits of advice. One from being a teacher and being in the education field. I would definitely recommend for more Muslims and more people of South Asian background to look into education if it's something that you're passionate about. It may not be the best paying job, but it's definitely really rewarding. And I've seen, especially being a Muslim and being in the schools, that a lot of people who may not have had interactions with Muslims are getting a chance to interact with somebody on a daily basis, and you can see perceptions change as well.
Especially nowadays.
Yeah, so I would definitely suggest to the parents, if your son or daughter is interested in the education field, don't discourage that. I think it's something that's a really noble profession, and it's something that can really make a big difference. And I think we already discussed quite a bit about the importance of communication at home. Yeah. And I would also recommend again that because there's so much information on the internet, to make sure you're using reliable resources if you are using the internet. So again, I used WebMD as an example, but or Wikipedia or something like that. You don't want to necessarily go and look up really important information on there. So if you are concerned about something, if you feel, hey, I'm seeing differences in my son or my daughter, could these be signs of depression or signs of anxiety or something, you can definitely reach out to doctors, reach out to, different websites online, Mayo Clinic or some of these more reputable,
or they can even come to the teacher and say, have you seen, is my son doing this in school, or how are they participating in class?
Yeah,
they can come and talk to the teacher as well.
And schools end up being small communities, so a lot of the times word gets around about something's happening to this person or to that person or whatever. So usually teachers will know what's going on in the school, and we try and make sure that we keep parents in the loop, so that they can obviously help students at home.
Good advice.
Good advice.
Dr. Amin.
So for anybody who's willing to, for anybody who is interested in pursuing a career in pharmacy, it's not only a lucrative field, but it's also very rewarding, and it's very broad in the jobs that we have. Like you said, there are so many things that pharmacists do, and depending on your interest, it can cater to many different interests. And for the patients, if you're ever on any medication, always remember even the smallest thing counts to tell your physician. Whether you're on any nutraceuticals, any supplements, any medications that you would think that it's not a big deal. So many things interact. The biggest things we look at are drug interactions, or if it could be simple things like not just interactions, but if you're not taking things properly. So no information is too small. You should mention everything, and especially for pharmacists, we're kind of the middle person. We'll listen. You can tell us, and we can tell your doctor. We're underrated profession. You can talk to us, and we can.
Definitely.
Yes, we'll
awesome.
definitely help.
Great advice. Dr. Umar, before you give an advice to our viewers, I want to ask you a very quick question.
Sure.
ये जो hot pack, cold pack pain को दूर करने के लिए, what do you say about it? Pakistan में it's hot water bottle. Okay, यहाँ it's cold pack. So
I typically tell patients in medicine, if it helps, do it. If it hurts, don't do it.
Okay.
But typically,
which one is better?
Well, so it really depends on the patient. But I typically tell people for any sort of swelling, cold would be better to decrease the inflammation. If there's any sort of pain, heat can help. But I've seen that it can work as in the opposite as well. So but you don't want to leave it on for too long, regardless of what you choose. But definitely either or should be okay.
So now what's your advice to her?
So I have a couple of different pieces of advice. One for the students or maybe thinking of a career in medicine. You definitely want to make sure you do something that you love. Okay, you can't just go for what's lucrative or what's not, because, like I mentioned, there's a lot of time commitment to it that people don't really understand. There's 13 years of high school. That was my entire 20s to get to this point. So you really have to love what you do, because if you're just doing it because, especially among Desis, you're a doctor, okay, that's great, but at the end of the day, you have to live your life, and you can't do it because the community wants you to, or family expects you to. Because if you're not happy with it, then it's going to affect your patient's care. It can affect everything you do in life. And again, patients' lives are in your hands. So ultimately, it's up to Allah subhanahu wa ta'ala. But if you're making a mistake because you're careless or you don't care about what you're doing, you can really drastically affect someone's life. So definitely make sure you choose something that you really love to do and pursue it with all your heart. Even with my patients, when I'm with the patient, I give them all my love and care and attention, because that's what they need, and then I move on to the next one. As far as for the older viewers, my advice to them is just go and move. Just move around. The best thing you can do is be as active as possible. The worst thing you can do is sit around doing nothing. So try and be as active as you can to help keep your energy, keep your strength up. And that'll help a lot.
Even if it's going for a walk or just
walks.
Vacuuming the house. Or,
right.
I need small things.
Right. And definitely, especially as the weather gets nicer, to go outside is always a good thing.
Awesome. Great advice. It's I know that people actually know this, but they don't do it.
Right.
So coming out of your mouth, probably more people would start working.
I hope so.
Inshallah.
Inshallah. Then they'll come to me less because they won't need me. So that's good. That's good.
ख़वातीन हज़रात, आपने हमारा आज का प्रोग्राम देखा. आज आप हमारे 3 गेस्ट से मिले, जो कि इंतहाई, जैसे हमने शुरू में कहा था, कि ये दिलचस्प और बहुत इम्पोर्टेंट सब्जेक्ट पे इन्होंने डिस्कशन की। इन तीनों ने हमें ज़िंदगी के बारे में बहुत कुछ आज हमें लेसन दिया। Although these youngsters are here, but they have the specialized education about learning and teaching in life. So they did that for us, and we believe for you also.
आज का प्रोग्राम हमारा ख़त्म होता है। इंशाल्लाह अगले हफ्ते आपसे मुलाकात होगी। अल्लाह हाफिज़।